Hello, my name is Dr. Shah, and I'm the founding attorney of the Doctor Lawyer Law Group. As a board-certified medical doctor and attorney with combined 30 years of experience, I and my associates have created a remarkable law firm dedicated to the victims of medical malpractice, wrongful death, and catastrophic personal injury, including personal injuries sustained in motor vehicle accidents. Today, I want to take a moment and discuss with you an important and complex medical topic, and that is a topic regarding sepsis. In this video, I hope to better define what sepsis is, what some of its signs and symptoms are, the kinds of folks that are susceptible to sepsis, and what a competent medical provider should be capable of doing in promptly recognizing it and treating it. So, what is sepsis? Well, sepsis always begins with an infection. Now, in the vast majority of instances, when a human being contracts an infection, there is an appropriate immune response designed to mitigate the infection, kill off the pathogen that is causing it. Unfortunately, in some instances, the immune system can be overexuberant, too severe, and become as big a problem as the original infection. When this awful combination occurs, in which there is an underlying infection combined with an immune system response that is inappropriate, well, then the conditions are set for sepsis. When sepsis becomes severe, there is a term often used even in the lay literature called septic shock. The patient is in septic shock. What does that mean? Well, when the immune system combined with the underlying infection becomes too severe, it will cause a catastrophic drop in the blood pressure that the patient has. And unless that blood pressure drop is treated promptly, that patient is likely to die of septic shock. So now that we have a better understanding of what the setting is for sepsis and septic shock, and how it actually occurs as this odd combination of an underlying infection combined with an overly exuberant or too severe immune response, what are the signs and symptoms of it? Well, in these patients, some of the signs can be subtle, and that's why a competent medical provider has to be properly trained and vigilant to recognize them. So these patients will oftentimes present with a fever inappropriately high for the diagnosis that is being made. Or, in other instances, their core body temperature will actually be unusually low. In addition, many of these patients will present with a heart rate that is either too rapid or too slow. Similarly, in many patients that have impending sepsis, their breathing rate can either be too fast or too slow and shallow. In addition, many of these patients will present with confusion and other evidence of cognitive dysfunction. Taken in an amalgam, all of these signs and symptoms can be heralds of impending sepsis. Now, what kinds of patients are most vulnerable to the possibility of sepsis? Well, first of all, it's the bookends, the extremely young and the extremely old. So the premature babies and the neonates, those that are just out of the womb, are most susceptible to sepsis, as well as our elderly, those who are in long-term care facilities or who are hospitalized because of an underlying infection. In addition, patients that have chronic kidney disease, chronic liver disease, chronic rheumatologic disease, or other bases for being immunocompromised. Immunocompromised means that the immune system isn't working properly to begin with. What kinds of patients have this? Well, patients, for example, who are on chronic steroids, or patients who are on other medications that are designed to control or limit rheumatologic diseases, for example. These populations of patients, those with chronic disease, those who are immunocompromised, those that are too young, or those that are too elderly, are the classic subsets of the human population that are vulnerable to sepsis. But I want to make an important point. It can also occur to just about anyone. And the underlying infection can literally be anywhere. It can be in soft tissue, it can be a spinal infection, it can be an abdominal infection, it can even begin with something as innocuous as a dental tooth infection or a throat infection. Any one of these infections, even in patients that don't fit the classic profile, can go on to cause sepsis. And a competent clinical medical provider has to be able to recognize the warning signs and symptoms and treat them accordingly. So how do you treat Sepsis. Well, sepsis requires hospitalization. Sepsis will often require intravenous antibiotics, and sepsis will often require intravenous fluids as well as other medications designed to keep the blood pressure stable. Unfortunately, in many instances, patients will present with all the signs and symptoms of impending sepsis, but leave the urgent care, leave the emergency room, or leave that medical provider with a diagnosis of simply infection. Those patients are often treated with just oral antibiotics, and if they're discharged with just oral antibiotics, oftentimes the outcome is catastrophic, and even death can be the consequence. If you or a loved one has been misdiagnosed and the diagnosis of sepsis was missed, you owe it to yourself to consult the Doctor Lawyer Law Group.